Hello and welcome. I expect that you know who I am, but just in case you are new to the SPH community, I'm John Finnegan, Dean of our School of Public Health. So today I want to update you on the employee engagement survey that we were all involved with back in 2015. And I want to show you how your feedback has shaped the school's actions and guided our improvements in the school over the past 2 years since the last survey. For those of you that are new to the school, let me tell you a little bit about the survey. The university's Office of Human Resources has been sending the engagement survey to every benefits-eligible faculty and staff member since 2013. And the reason for this survey is to gauge your satisfaction in your workplace and with the work that you do. So after 2015, the Office of Human Resources decided to do the survey every other year, every second year, rather than every year. And in part, that decision was made to allow those of us in leadership and decision-making positions to be able to respond to the good feedback that we received on each of those surveys. And I do want to remind you that the University of Minnesota contracts with the Hayes Group, which is an external company, to do and conduct this survey and to assure that your anonymity is maintained. When the last survey was done in 2015, it asked questions in two main areas. One, your level of commitment and dedication to your work, and two, how effective is your work environment in supporting what you do? In early 2016, Human Resources rolled out the survey report to leaders of university units. Leadership at the School of Public Health received reports that showed data for School of Public Health faculty, the staff, faculty and staff in each of the school's 4 divisions: biostatistics, health policy and management, environmental health sciences and epidemiology, and community health. Employees in the school-wide units, mainly dean's office and centers, were also included. From March through August 2016, school leadership worked with University Human Resources and our own school's human resource team to share all survey data and to hold discussions with faculty and staff about how to use the responses to continue to improve the quality of people's workplace experiences. For example, on June 7th of 2016, I conducted a town hall session live with faculty and staff in Mayo, with a WebEx connection for faculty and staff at West Bank Office Building and at 2221 University Avenue. We also recorded and shared the town hall with faculty and staff who were not able to attend. The Division of Epidemiology and Community Health shared results with faculty at a meeting in March 2016 and with staff at a June meeting. Biostatistics faculty and staff had conversation about the results at a July meeting. We discussed survey results with the school-wide units at a July staff meeting. Environmental Health Sciences held a session on August 30th, and when he began his leadership role as division head in the summer of 2016, Tim Beebe shared the survey results more informally as he worked with faculty and staff to develop plans and to set direction for the Division of Health Policy and Management. Making this school the best it can be for faculty and staff takes a commitment to continuous quality improvement, or as we say, CQI. I very much appreciate everyone who completed the engagement survey in 2015 and who participated in the discussions in the following year. We took your comments and feedback to heart, and I want to share with you some of the progress that we have made with your help. 3 major themes emerged from the 2015 survey. One was a desire for faculty and staff to work more with school leadership and better understand and be part of decision-making and direction setting for the school. So to that end, over the past 2 years, with faculty and staff input, we hired Diane Newmark-Steiner to lead epidemiology and community health, and Tim Beebe to head health policy and management. Members of school leadership regularly join the meetings of staff and faculty governance advisory groups to discuss and share ideas about and answers to the challenges that face the school. Those groups include the Faculty Consultative Committee, FCC, the P&A Staff Senate, the Staff Association for Civil Service and Labor Represented Staff, the Education Policy Committee, the Appointment, Promotion, and Tenure Committee. Chairs and representatives from these advisory groups participate in the school's executive team meetings to provide feedback on direction setting for the school. They are encouraged to communicate with their constituencies about all the decisions that we make. Faculty and staff came together as the most important group to help build our brand so that we can best position the school in the ever-increasing market of schools and programs of public health. Their voices were vital in discerning how to combine our history, strengths, advantages, our personality, and our values to forge our distinct identity. We strive to better communicate about school direction and have separated SPHERE, S-P-H-E-R-E, into faculty, staff, and student versions. And the reason for that was to present news and information in a much more targeted fashion. And we continue to build our school website so it provides critical information for staff and faculty. Working with division administrators, our school human resources team introduced a comprehensive new employee onboarding approach so that when faculty and staff start working here, they understand school expectations, our organization, and the resources that we have from the very start. Our school's academic affairs team ensures new faculty are well-oriented to support their success. Our annual faculty and staff recognition celebration in May is a key time for everyone to come together to celebrate our individual and our collective accomplishments. At that gathering, I also share a State of the School address so that everyone knows our priorities and our progress and our challenges. A second major theme was a desire for faculty and staff to be better supported in their professional development and for more collaboration across divisions. So keeping this theme in mind, we have created a collaboratorium within the Dean's Office Suite in Mayo to provide space for faculty to gather and to collaborate. Leadership also makes efforts to have a better presence in the West Bank office building to better connect and to work with faculty and staff in epidemiology and community health. We have continued to support assistant professors and associate professors from across the school to meet on a regular basis, to share ideas, to support one another, and to support their continued career development and progress. We have developed an online faculty directory with a staff directory in development right now. We have inaugurated an SPH Faculty Leads Leadership Development Program in 2016 and 2017 and held our first sessions there. We have also begun the SPH Staff Leads Leadership Development Program in 2017 with a second offering planned for 2018 because of the high level of applicants. We also heard your need for more attention to diversity, equity, and inclusion across the school. The 2013 and 2014 engagement surveys particularly showed faculty and staff uncertainty over our organizational commitment to diversity. We take our school's role in advancing these issues very seriously, and we've done the following things in the last several years. One, we formed the Diversity and Equity Action Leadership Team called DELT. It is made up of students, faculty, and staff who contribute to shaping policies and practices that will promote a more equitable, diverse, and inclusive School of Public Health environment by serving as a think tank to advise me and other leadership in the school. Secondly, we launched the Equity, Diversity, Inclusion Team, the EDIT team, again made up of students, faculty, and staff who proactively address diversity and equity issues through a variety of creative ways, with the main focus being facilitated school conversations. We have implemented active recruitment and implicit bias training in the hiring and search processes. We have also begun a school-wide equity, diversity, and inclusion plan to be shared with everyone in the fall of 2017. And finally, we've hired Lauren Eldridge as our new Diversity, Equity, and Inclusion Coordinator based in our school's Student Services Center. So thank you very much for spending some time with me today, and especially thank you for using your voices and hard work to make these advances possible at our school. My door is always open if you want to talk over any of the things that I've mentioned. And I want to remind you that on October 16th, the university will launch the 2017 Employee Engagement Survey. And I encourage all of you to take part in the survey and complete it. Your answers are going to help us keep the school moving forward as we work to create an environment where all of us, faculty, staff, can thrive and grow. Again, thank you very much. Remember, all are welcome here, and go Gophers.